Explain the physiological differences between crystalloids and colloids and under what clinical circumstances each should be preferred. Answer. Crystalloids are water-based solutions containing electrolytes, salts like sodium chloride. They can pass through membranes, distributing water to both intravascular and interstitial spaces, making them ideal for treating dehydration, initial shock, or as maintenance fluid. Crystalloids are inexpensive and widely used, but they can rapidly leave the vascular compartment, requiring larger volumes to maintain effective blood volume. Examples include saline and lactated Rinner solution. Colloids, such as plasma or synthetic starches, contain larger molecules that increase osmotic pressure and remain in the blood vessels longer. They are preferred when rapid volume expansion is needed, especially in cases of hypoproteinemia or severe blood loss. They are more effective in maintaining vascular volume but are more expensive and carry a higher risk of side effects like allergic reactions. Guideline. The AAHA guidelines recommend using crystalloids for general hydration and colloids for cases with significant fluid loss or low albumin levels. Colloids are especially beneficial for hemorrhagic shock, but excessive use can lead to coagulopathies. Compare and contrast the indications and risks associated with venipuncture versus cystocentesis. Answer. Venipuncture is a method used to collect blood from veins. It's common for routine blood work or catheter placement and is typically performed on accessible veins like those in the cephalic or jugular area. Risks include hematoma formation, vessel collapse, and infection if proper aseptic techniques aren't used. Cystocentesis, on the other hand, is a sterile procedure for collecting urine directly from the bladder, usually for culture or diagnostic testing. It involves inserting a needle through the abdominal wall into the bladder. The procedure is especially useful for sterile urine samples, but carries risks like bladder rupture, hematuria, and introduction of infection if not done under proper aseptic conditions. Guideline. Both techniques require strict aseptic techniques to avoid complications. The AVMA and AAFP recommend using ultrasound guidance for cystocentesis when necessary. Venipuncture is preferred for general blood collection due to its simplicity, but cystocentesis is essential for collecting uncontaminated urine samples. Mrs. Patel brings her 8-year-old Labrador Retriever Max into the clinic after observing labored breathing, pale gums, and lethargy. Max was recently diagnosed with cardiomyopathy. What monitoring parameters should be prioritized for Max and why? Answer. For Max, priority monitoring parameters include respiratory rate and effort. Since Max has cardiomyopathy, labored breathing could indicate pulmonary edema or congestive heart failure. Close monitoring will help assess the severity of his respiratory distress. Mucous membrane color and CRT. These help assess tissue perfusion and oxygenation. Pale gums suggest poor circulation, a possible sign of poor cardiac output or shock. Blood pressure. Hypotension may accompany heart failure, so blood pressure monitoring is crucial to assess perfusion status. Electrocardiogram. Cardiomyopathy can cause arrhythmias. CG will help detect irregular heart rhythms, which may worsen his condition. Pulse oximetry and blood gas analysis. Monitoring oxygen saturation levels helps determine if supplemental oxygen is required, and blood gas analysis evaluates respiratory and metabolic status. Guideline. The ICOVE our guidelines on cardiopulmonary resuscitation, CPR, and monitoring stress the importance of continuous observation for patients with cardiovascular conditions. Explain the steps and precautions involved in the Gram staining process and discuss how missteps can lead to diagnostic errors. Answer. Gram staining steps. Apply crystal violet to the smear, staining all bacterial cells purple. Add iodine or mordant to fix the dye. Decolorize with alcohol or acetone to differentiate bacterial types based on cell wall composition. Gram-positive cells retain the violet color, while gram-negative cells lose it. Counterstain with saffron into color gram-negative cells red. Precautions. Over-decolorization. If the slide is over-decolorized, gram-positive bacteria may appear gram-negative, leading to misclassification. Under-decolorization. Incomplete decolorization can cause gram-negative bacteria to appear falsely gram-positive. Fixation issues. If bacterial cells are not properly fixed, they may wash off, yielding inaccurate results. Diagnostic errors. Misclassification may result in inappropriate antibiotic treatment, worsening infections or contributing to antimicrobial resistance. Describe the step-by-step protocol for managing a dog that ingested antifreeze within the last 2 hours. Include antidote recommendations. Answer. Induce vomiting. If within 2 hours of ingestion, induce vomiting using apomorphine if safe, or activated charcoal to limit absorption of toxins. Administer activated charcoal This binds any remaining toxins in the gastrointestinal tract, reducing systemic absorption. Fluid therapy. Administer intravenous fluids such as saline or Ringer's lactate to promote renal diuresis, enhancing excretion of ethylene glycol metabolites. Administer antidote. Fomepizole or ethanol inhibits alcohol dehydrogenase, preventing the toxic metabolites of ethylene glycol from being produced. Continuously monitor kidney function, electrolytes, and acid-base balance. Blood gas analysis is crucial to evaluate acidosis levels. Guideline: the AHA recommends initiating decontamination as soon as possible for ethylene glycol ingestion, as the metabolites are rapidly absorbed. Both fomepizole and ethanol are effective in preventing toxic metabolite formation, with fomepizole being preferred due to fewer side effects. Discuss the key components of a biosafety plan in a veterinary laboratory, emphasizing the handling of zoonotic pathogens. Answer: a comprehensive biosafety plan includes risk assessment, identify potential zoonotic pathogens, e.g. Leptospira brucella, and the risks they pose to personnel. Personal protective equipment (PPE). Staff must wear gloves, lab coats, face shields, and masks when handling specimens potentially containing zoonotic agents. Containment and ventilation. Use biosafety cabinets. Consommation for handling infectious material. Ensure proper ventilation to prevent aerosol transmission. Waste disposal. All contaminated materials, gloves, swabs must be disposed of in autoclaved biohazard containers. Training and education. Continuous training on biohazard handling protocols is required for all laboratory staff. Guideline: OSHA mandates a written biosafety plan that includes specific guidelines for zoonotic diseases. Regularly updating protocols and training personnel ensures safety and compliance with regulatory standards. What are the critical steps in performing CPR on a large dog, and how does the approach differ from CPR on smaller dogs or cats? Answer: steps for large dogs. Position the dog. Place the dog in right lateral recumbency on its side. Chest compressions. Use both hands over the widest part of the chest. Perform compressions at 100-120 compressions per minute with a depth of 1/3 the chest's width. Ventilation. Ventilate every 6 seconds using a bag valve mask or intubation if available. Differences for smaller animals. Positioning. For small dogs or cats, compressions are often done over the heart rather than the chest. Compression technique. Use one hand for smaller dogs and fingers for cats. Compression depth. For small animals, compression depth is less, about 1/2 the chest's width. Guideline. Follow RE, COVE, Resuscitation and Critical Care Consensus. Guidelines for appropriate compressions and ventilation rates tailored to animal size. Proper positioning and technique ensure the effectiveness of CPR. Why is it critical to select the appropriate culture media, and how does media choice influence bacterial identification? Answer: selecting the right culture media is crucial because different media provide specific nutrients that either support or inhibit bacterial growth. For example, general media e.g. cells support a wide range of bacterial growth. Selective media e.g. MacConkey agar inhibit the growth of certain organisms while supporting the growth of others. MacConkey is particularly useful for isolating gram-negative bacteria. Differential media e.g. help identify bacteria based on biochemical reactions. For instance, lactose fermenters appear purple on MB agar. Impact on identification. Using inappropriate media can result in poor bacterial growth or failure to identify key diagnostic features. For instance, if the wrong medium is chosen, some pathogens may not grow, leading to misdiagnosis. Guideline. The CLSI recommends using specific media for certain types of infections, as the proper medium will optimize bacterial isolation and allow for accurate identification. Discuss how the use of antibiotics in veterinary medicine can lead to resistance and what steps can be taken to prevent it. Answer: the overuse and misuse of antibiotics in veterinary medicine, such as unnecessary prescriptions for viral infections or inappropriate doses, contribute to the development of resistant bacteria. Resistant pathogens evolve by adapting to the drug, making treatment less effective. Preventive measures. Antibiotic stewardship. Only prescribe antibiotics when necessary and ensure the right antibiotic is chosen for the infection type. Follow dosage guidelines. Administer antibiotics according to the recommended dose, duration, and frequency. Culture and sensitivity testing. Before prescribing antibiotics, perform culture and sensitivity tests to identify the most effective drug. Guideline. The AVMA and WHO emphasize antibiotic stewardship, encouraging veterinarians to limit unnecessary antibiotic use and to educate pet owners on responsible antibiotic use. How does anesthesia monitoring differ between small and large animals, and what are the key parameters to focus on? Answer: in small animals, anesthesia monitoring focuses on heart rate, respiratory rate, blood pressure, and end tidal coat. For larger animals like horses or cattle, the same parameters are important but require adjustments in equipment and techniques due to their size. For example, heart rate. Small animals generally have higher heart rates, so tachycardia or bradycardia can be more easily detected. Blood pressure. Larger animals may require larger cuffs for accurate measurement. Oxygenation. The volume of anesthetic gases required differs, so ventilators must be set appropriately for the animal's size. Guideline. The American College of Veterinary Anesthesia and Analgesia provides detailed recommendations on anesthesia protocols based on species and size. Explain how to identify dental pathologies during an oral examination in dogs. Include an explanation of the grading of tartar buildup. Answer: dental pathologies in dogs are identified through a systematic oral examination that includes inspection, palpation, and sometimes radiographic imaging. The key signs to observe include gingivitis, red swollen gums that may bleed upon gentle pressure, periodontitis, recession of gums, loose teeth, and possible abscess formation, fractured teeth, visible cracks, pulp exposure or discoloration indicating pulp necrosis, oral masses. Evaluate for benign growths, gingival hyperplasia or malignant lesions. Tartar buildup graded as follows: Grade 1 mild, slight discoloration or thin calculus along the gum line. Grade 2 moderate, visible tartar with inflammation of surrounding gums. Grade 3 severe, heavy tartar leading to gum recession and visible tooth root. Relevant guidelines. The American Veterinary Dental College outlines that consistent oral exams are vital for early detection of dental diseases and preventing progression to systemic complications. Dr. Smith is an animal health technician handling an injured hawk brought in by Wildlife Services. The hawk is highly stressed and exhibits defensive behavior, including attempts to bite and scratch. How should Dr. Smith proceed to minimize stress and injury to both the hawk and herself? Answer: Dr. Smith should adhere to the following steps. Preparation. Wear protective gloves and long-sleeved clothing to prevent injuries. Ensure the room is quiet, dimly lit, and free of sudden movements to reduce the hawk's stress. Restraint technique. Approach the bird calmly, speaking in a low tone. Use a towel to wrap around the hawk's body, immobilizing the wings without applying pressure to the chest to avoid respiratory distress. Control the talons by securely grasping both legs together using one hand, monitoring stress levels. Pause handling if the hawk exhibits open mouth breathing or signs of exhaustion. Allow rest periods during extended procedures. Why is subgingival scaling crucial during a professional dental cleaning, and what tools and techniques are used to perform it effectively? Answer: subgingival scaling is critical because plaque and tartar beneath the gum line contribute to periodontal disease, leading to tooth loss and systemic health issues, e.g. endocarditis. Techniques and tools include ultrasonic scalers, high-frequency vibrations to dislodge tartar with minimal damage to the enamel, hand instruments, curettes, designed for subgingival scaling, removing debris while preserving tissue integrity, Exploris probes, assess pocket depth and ensure all deposits are removed, polishing, smoothens enamel surfaces post-scaling, reducing plaque accumulation risk. Relevant guidelines. The AVDC mandates that all dental cleanings include subgingival scaling as part of comprehensive prophylaxis. A veterinary technician is tasked with formulating a diet for a green iguana. What factors must be considered to meet its nutritional requirements, and why is improper feeding a common cause of metabolic bone disease? Answer: green iguanas are herbivores requiring a balanced diet with high calcium and low phosphorus ratios. Considerations include diet composition. Leafy greens, collard greens, dandelion greens, and mustard greens provide calcium. Fruits, limited to prevent excess sugar intake. Supplements, calcium powder with vitamin D to support bone health. Lighting and temperature. UVB light exposure is essential for synthesizing vitamin D, enabling calcium absorption. Avoiding common mistakes. High phosphorus foods, e.g. spinach or improper calcium supplementation disrupt the calcium-phosphorus balance, leading to metabolic bone disease. Relevant guidelines. The Association of Reptile and Amphibian Veterinarians (ARAV) emphasizes proper diet and UVB lighting as preventative measures against nutritional disorders. Describe the bisecting angle technique in dental radiography. Why is it preferred for capturing images of canine teeth? Answer: the bisecting angle technique is used when direct imaging is impractical due to anatomical limitations. Steps include positioning. Align the X-ray beam perpendicular to an imaginary line, bisecting the angle formed by the tooth long axis and the sensor film plane. Application for canines. The canine roots are elongated and not parallel to the sensor, making this technique optimal for reducing distortion. Evaluation. Ensures clear visualization of root structures and periodontal health. Relevant guidelines. This method is endorsed by the AVDC for accurate imaging of irregularly shaped or positioned teeth. A 5-year-old African grey parrot has been brought into the clinic with a history of feather plucking. What are the common underlying causes of feather plucking in parrots, and how should an animal health technician approach diagnosing and treating this condition? Answer. Feather plucking in parrots can result from a variety of physical, environmental, and psychological factors. Common causes include medical causes, dermatological disorders, parasites, mites, lice, or fungal infections, nutritional deficiencies, lack of essential fatty acids, vitamins, or minerals, hormonal imbalance. Seasonal changes or reproductive issues can contribute. Psychological causes, boredom or stress, lack of stimulation or social interaction, separation anxiety, attachment to the owner leading to stress when separated, diagnosis and treatment. History and physical exam. Look for signs of infection, abnormal skin or feather conditions, and other systemic signs. Behavioral assessment. Address potential psychological causes through enrichment, environmental modification, and interaction. Treatment. Treat underlying medical issues, provide behavioral therapy, and offer proper nutrition, including a balanced diet with essential nutrients. Describe the role of dental radiographs in assessing periodontal disease and tooth root health. What are the key signs of advanced periodontal disease visible in radiographs? Answer. Dental radiographs are essential for detecting the full extent of periodontal disease, especially when clinical signs, e.g., gum recession or loose teeth, are not yet apparent. Key findings on radiographs include loss of bone density. In advanced periodontal disease, radiographs reveal bone loss around the tooth roots, indicating the progression of periodontitis. Loss of the lamina dura, the dense bone surrounding the tooth root, is a significant sign. Tooth root resorption or abscesses. Infected teeth may show root abscesses or resorption, which can cause tooth mobility. Radiographs will often demonstrate changes in the root structure, including irregularities or blurring of root contours. Periodontal pocketing. Radiographs can show an increased space between the tooth root and alveolar bone, reflecting the deepening of periodontal pockets. Explain the differences in metabolic rates between reptiles and mammals and how these differences impact the veterinary care provided to reptiles in clinical settings. Answer. Reptiles and mammals have significant physiological differences that affect their metabolism, nutrition, and care needs. Key differences include metabolic rate. Reptiles, cold-blooded animals, ectothermic, have a low metabolic rate and rely on environmental temperature to regulate their body heat. This means they require carefully controlled temperatures in their habitats to digest food and maintain proper organ function. Mammals, warm-blooded animals, endothermic, maintain a constant body temperature through internal metabolic processes, which supports a higher metabolic rate. Impact on veterinary care. Reptiles. Veterinary care must focus on temperature regulation, hydration, and specific dietary needs, e.g., calcium and UVB light for bone health. Inadequate environmental conditions can lead to diseases like metabolic bone disease. Mammals. While temperature control is important, mammals can tolerate a broader range of environmental conditions and typically have a more stable response to fluctuations in temperature. Anesthesia considerations. Reptiles' slow metabolism requires longer recovery times from anesthesia, and their response to medications is often more variable. They may need slower induction doses and extended monitoring post-procedure. Relevant guidelines. The American Association of Zoo Veterinarians (OSV) provides specific protocols for reptile care, emphasizing species-specific physiological needs and their impact on medical treatment and care. Describe the steps involved in performing a tooth extraction on a dog with periodontal disease, including preoperative preparation and postoperative care. Answer. Tooth extraction in a dog with periodontal disease requires thorough planning to prevent complications and ensure optimal recovery. The steps involved include preoperative preparation, assessment and diagnostics, radiograph to evaluate the extent of periodontal disease and root involvement, blood work to ensure the dog is healthy for surgery, anesthesia, pre-anesthetic medications, e.g., analgesics, sedatives, and induction of general anesthesia, ensuring the dog is properly intubated and monitored during the procedure. Surgical procedure, accessing the tooth, make an incision in the gum tissue over the affected tooth. Tooth extraction, loosen the tooth using dental elevators and, if necessary, section the tooth to facilitate removal. Care is taken to avoid damaging surrounding tissues. Alveolar bone curettage. Clean the bone socket to remove infected tissue and debris. Post-operative care. Pain management. Administer post-operative analgesics and antibiotics to prevent infection. Wound care. Monitor the extraction site for swelling or infection and recommend a soft food diet for a few days to minimize discomfort. Follow-up. Schedule a follow-up appointment to ensure proper healing and assess for any complications. Relevant guidelines. The AVDC outlines proper protocols for performing dental extractions, emphasizing sterile technique, pain management, and post-operative care to prevent complications like infection or excessive bleeding. Mr. Green, a wildlife rehabilitator, needs to safely capture a raccoon with a suspected leg injury. The raccoon is stressed and defensive. How should Mr. Green proceed to minimize harm and ensure safe transport to the clinic? Answer: Mr. Green should follow these steps. Preparation. Ensure appropriate protective clothing, including gloves and thick clothing to prevent bites or scratches. Prepare a safe enclosed transport container that will securely hold the raccoon without causing additional stress. Restraint techniques. Approach the raccoon slowly, ensuring that the animal has a clear escape route to reduce panic. Use a net or blanket to cover the raccoon, immobilizing its body and minimizing movement. If necessary, apply gentle pressure to control the animal's head and limbs. Hold the raccoon's body with one hand while securing the head with the other to avoid injury during transport. Ensure the raccoon is transported in a well-ventilated, dark, and secure crate to reduce anxiety. Monitor the animal closely during transport, providing soft bedding for comfort. Describe the life cycle of Toxocara canis and explain how understanding its life cycle is critical for implementing effective control measures in a clinical and community setting. Answer: Toxocara canis, a ramum commonly found in dogs, has a direct life cycle with potential for paratenic hosts. Life cycle overview. Dull worms reside in the intestines of dogs, releasing eggs that are shed in feces. Eggs embryonate in the environment over 2-4 weeks, becoming infective. Larvae hatch upon ingestion by a host and migrate through tissues. In puppies, larvae travel to the liver and lungs before returning to the intestines. In older dogs, larvae may enter a somatic migration phase and insist in tissues. Paratenic hosts, e.g., rodents or humans, ingest eggs, with larvae insisting in tissues. Significance for control. Regular fecal testing and deworming in pets interrupt the life cycle. Proper sanitation and public awareness prevent human infections. Toxocariasis. Zoonotic risk underscores the importance of early puppy treatment and environmental cleanup of feces. Compare the fecal flotation and Behrman technique in diagnosing parasitic infections. Discuss the advantages of each and the situations in which they are most applicable. Answer: fecal flotation, used to detect light parasitic ova, e.g. nematodes, cestodes, involves mixing feces with a flotation solution, e.g. saturated salt when examining eggs that float to the top. Advantages: simple, cost-effective, and detects common parasites. Limitations: ineffective for heavy eggs or larvae. Behrman technique, designed for detecting live larvae, e.g. strongyloids spp. Fecal material is suspended in water, encouraging larvae to migrate downward due to gravity. Advantages: specific to larvae, particularly useful for lungworm infections. Limitations: requires time and specialized setup. Clinical application: a Behrman test is preferred for diagnosing strongyloids spp, while fecal flotation is ideal for routine screenings. Dr. Patel manages a rural veterinary clinic with high cases of Fasciola hepatica, liver fluke, infections in livestock. These animals graze near a stagnant water source. What integrated management strategies should Dr. Patel implement to control the parasite and reduce its prevalence? Answer: Dr. Patel should focus on interrupting the life cycle of Fasciola hepatica, which involves snails as intermediate hosts. Environmental control: drain or fence off stagnant water sources to minimize livestock access. Reduce snail habitats by altering vegetation and water flow. Pharmacological intervention: minister flucicides, e.g. triclobendazole, strategically during peak transmission times. Monitoring and education: conduct fecal examinations to assess infection rates and treatment efficacy. Educate farmers about rotating pastures and avoiding high-risk areas. Regulatory compliance: adhere to local food safety and drug withdrawal periods to ensure compliance with public health standards. Explain the importance of antimicrobial stewardship in veterinary practices and outline key strategies to prevent antimicrobial resistance. Answer: antimicrobial stewardship ensures responsible use of antibiotics to mitigate the risk of antimicrobial resistance. Importance: preserves antibiotic efficacy for both animal and human medicine, reduces the spread of resistant bacteria through the food chain, Key strategies: use antibiotics only when necessary and based on susceptibility testing. Educate clients about completing prescribed courses and avoiding overuse. Employ infection control measures like sterilization and hygiene. Follow guidelines from organizations such as the WHO or VMA. Regulations like the Veterinary Feed Directive (VFD) in the US enforce the judicious use of antimicrobials in livestock. Discuss the role of post-exposure prophylaxis (PEP) in rabies prevention and outline the procedures recommended following a suspected rabies exposure. Answer: P is critical in preventing rabies after potential exposure. Procedure: immediate and thorough wound cleaning with soap and water. Administration of rabies immune globulin rigged near the wound. A series of rabies vaccinations according to WHO guidelines. Legal requirements: rabies vaccination is mandated for pets in most jurisdictions. Quarantine periods for unvaccinated animals exposed to rabies vary by region, e.g., 10 days in the US. Public health impact: P is highly effective if initiated promptly, but ineffective once clinical symptoms appear. Awareness campaigns and vaccination programs reduce transmission. Why is it essential to maintain a cold chain during the transportation of animal-derived food products, and what regulations govern this process? Answer: maintaining a cold chain during the transportation of animal-derived food products is critical to preventing bacterial growth, which can cause foodborne illnesses and spoilage. The cold chain refers to the process of keeping food at appropriate temperatures during handling, storage, and transport. Bacterial growth: when animal products such as meat, dairy, and eggs are not kept at low temperatures, bacteria like Salmonella, E. coli, and Listeria can multiply rapidly, posing health risks to consumers. Cold chain standards: according to HACCP and FDA guidelines, animal-derived food products must be kept at temperatures below 4°C during transport. Products intended for long-term storage should be frozen at -18°C. Regulatory oversight: the USDA and FDA regulate the safe transport of animal products, ensuring that appropriate temperatures are maintained to avoid contamination. Violations can lead to product recalls and health risks to consumers. Public health protection: following cold chain protocols reduces the risk of foodborne pathogens and maintains the quality of the product, safeguarding public health. Design an effective community education program to minimize the risk of zoonotic diseases. Highlight key components. Answer: an effective public education program on zoonotic diseases should focus on prevention, awareness, and community engagement. Educational campaigns focus on zoonotic diseases like rabies, toxoplasmosis, and leptospirosis, providing information on how these diseases are transmitted, symptoms, and prevention methods. Hygiene promotion emphasize proper hand washing, especially after handling animals or cleaning their habitats. Providing accessible sanitation facilities in high-risk areas is essential. Vaccination awareness: encourage pet vaccination programs, including rabies shots, and educate owners on the importance of regular deworming. Collaboration: work with local veterinary clinics, schools, and public health organizations to disseminate educational materials, hold workshops, and offer free screenings or vaccinations. Targeted programs focus on high-risk populations such as farmers, children, and pet owners. Use culturally relevant methods to engage the community, ensuring that the messages are clear and actionable. Discuss the concept of anthelmintic resistance in veterinary medicine. What factors contribute to resistance, and how can it be controlled? Answer: anthelmintic resistance refers to the ability of parasites, such as nematodes, to survive treatment with drugs anthelmintics that are usually effective in controlling them. This resistance develops over time and can lead to ineffective treatment and increased parasite burdens. Contributing factors: overuse: excessive or improper use of anthelmintics, such as underdosing or overfrequent treatment, accelerates resistance. Environmental factors: resistance can also evolve in environments with high parasite populations and poor sanitation. Control measures: rotation of drugs: using different classes of anthelmintics in rotation can reduce the risk of resistance. Strategic treatment: only treat animals when necessary and avoid overuse by conducting regular fecal egg counts to monitor parasite loads. Integrated control: implementing grazing management practices, improving sanitation, and using natural control methods can help reduce parasite loads and prevent resistance. Explain the importance of zoonotic disease control in veterinary practice. How can an animal health technician contribute to reducing the risk of zoonoses? Answer: Zoonotic diseases are infections that can be transmitted from animals to humans, posing a significant public health risk. Animal health technicians play a crucial role in preventing and controlling zoonotic diseases. Understanding zoonotic diseases. Zoonoses include diseases such as rabies, Lyme disease, and tuberculosis, which can be transmitted through direct contact with infected animals, vector-borne transmission, or consumption of contaminated animal products. It is critical to understand the life cycle and modes of transmission of these diseases to mitigate the risk. Veterinary role in control. Vaccination. Administering vaccines for diseases like rabies can significantly reduce the transmission of zoonotic diseases. Surveillance. Regular monitoring and early detection of zoonotic diseases in animals can prevent outbreaks. Educating pet owners and farmers. AHTS can provide essential education on safe handling practices, personal protective equipment, PPE, and hygiene measures to reduce zoonotic risks. Describe the life cycle of Fasciola hepatica, the liver fluke. What role does this life cycle play in the spread of the disease in livestock? Answer. Fasciola hepatica is a parasitic flatworm responsible for fascioliasis, which primarily affects cattle, sheep, and other livestock. Its life cycle plays a significant role in the spread of the disease. Life cycle stages. Eggs. The life cycle begins with eggs passed in the feces of infected animals, which contaminate water bodies. Muricidia. The eggs hatch into Muricidia, which must find a suitable snail host, often of the Lanier species, to continue developing cercaria inside the snail. The Muricidium transforms into cercaria, which are released into the water. Metacercaria. The cercaria insist on vegetation, becoming metacercaria, which are consumed by grazing animals. Maturation. Once ingested, the metacercaria migrate through the intestines to the liver, where they mature into adult flukes, causing liver damage. Infection of livestock. Animals ingest the metacercaria while grazing in contaminated areas. The parasites then migrate through the liver to mature into adults, causing liver damage and reduced productivity. Impact on livestock. The spread of Fasciola hepatica is influenced by contaminated water sources, particularly in wet, marshy environments. Infected animals suffer from liver damage, reduced milk and meat production, and may experience anemia. Control involves preventing access to contaminated areas, reducing snail populations, and using antiparasitic treatments. Understanding the life cycle is essential to control fascioliasis effectively.